Hi, I'm Kristen McCoy, a registered nurse in Louisiana, currently pursuing a master's degree in the acute care nursing program. From my time working in an emergency room, I have gotten to witness firsthand the misuse of services and the overall disparities that are created from a lack of health insurance coverage. If you think about it, a licensed driver that has a registered vehicle is required by law to have automobile insurance. And this is both for personal protection and for the protection of others. And in a way, the Affordable Health Care Act has a very similar application. A healthcare consumers report that was published by Families USA in 2009 stated that the average American family paid an additional $1,017 in premiums in 2008 to cover the cost of the uninsured. The Affordable Health Care Act combats this disparity in a number of ways. By requiring citizens to purchase coverage, the gap between the insured and the uninsured is significantly narrowed. And as President Obama has already stated, the more in the pool, the lower the cost for all in the pool. I feel that the role of the young adult in the Affordable Health Care Act significantly benefits its efficiency. While, of course, their participation is required by law, the benefits that young adults bring to the table can be felt by all Americans and not just the young adults themselves. A U.S. news publication that was written by Andrea Adlerman in 2013 recognized that young adults were a population that was least likely to have health insurance coverage, period. With the Affordable Health Care Act's dependent coverage qualification, young adults can stay on their parents' insurance coverage until the age of 26 if they qualify. This is going to broaden the umbrella for the insured citizens and help to decrease passing of the costs on from the uninsured. Those that don't qualify to remain on their parents' insurance plan are going to be young adults that stand to benefit the most from access to financial help to coverage under the Affordable Care Act. In other words, tax credits exist for young adults with incomes that are below the poverty line, which in turn makes coverage even more affordable. So as far as young adults go, the Affordable Care Act has implemented minimum standards for insurance plans, or minimum essential coverage, MEC. This ensures that the policy that's purchased covers the Affordable Care Act's 10 outlined essential benefits. These benefits offer comprehensive coverage, and the coverage suits the needs of a relatively healthy young adult. And this is going to protect the consumer from previously allowed practices of insurance companies, such as denial for pre-existing conditions and lifetime spending caps. Young adults are going to participate in the Affordable Care Act for a longer portion of their lifespan, and this generates a larger benefit and risk sharing for those who need the coverage now, which includes the elderly and the disabled. Miriam Reisman authored an article that was published in 2015, and it examined the Affordable Care Act's progress in the 5 years after its implementation. The article states that prior to the Affordable Care Act, young adults aged 19 to 26 were uninsured at a rate of 1 in 3. Currently, the uninsured 19 to 26-year-olds is at an all-time low since tracking began in 2008. The importance of young adults in the Affordable Care Act cannot be understated. Their participation and influx into the plan helps decrease the cost for all Americans, and because of their age, the benefits are going to transfer to older Americans for decades until these young adults need the coverage more frequently as this population ages. The coverage offered by the plan is affordable, and it's relatively suited to a young adult's needs. and tax credits are available for those that qualify in low-income situations. The U.S. Department of Health and Human Services reported that in 2015, 16.4 million Americans that were previously uninsured have now gained health insurance coverage. So with that in mind, the U.S. is well on its way to increases in access and quality of care thanks to the Affordable Health Care Act.